This is a report I put together in 2004, and some of these publications, which are available if you're interested, were from at least 5 to 6 years before that time. So the ability of adult stem cells to become all these tissues was known back then. And this is not something I know that you hear every day in the press. We hear that they're not flexible, they can't become these. They can become these, and we scientists are learning how to use them, not just to become those, but to treat diseases. So now you see all kinds of tissues that can be formed, and the good old fat cells there, from these different tissues of origin. Next, please. Now, these are some of the uses today. Not what we hope to do, not the promise. These are some of the uses today. These are patients being treated in clinical studies in the U.S. and around the world with adult stem cells. And again, this is a myth that is buried in the media. There are over 70 different disease states that are being treated with adult stem cells today. Brain and spinal cord injuries, brain damage due to lack of oxygen starvation, cerebral palsy, heart disease, various types of heart diseases. In fact, there are several companies here in the state of Florida who are doing, one has a phase 3 product of injecting cells into the heart of patients. There are several studies in the U.S. that are taking bone marrow cells from the patient, injecting it into the areas of the heart that are damaged, and treating patients. There's some literature outside if you're interested. There are open clinical trials right now inviting people to enter these trials. Now, I'm not telling you this is the sure cure, because this is all, again, it's experimental, it's in clinical trials, but they're showing some very early promise in all of these indications. Diabetes, and you hear diabetes, everybody saying we need embryonic stem cells. There are clinical studies underway today treating diabetes, type 1 diabetes. Next, please. The blood disorders. Leukemias, as I mentioned, has been treated. Actually, that was the first use of stem cells before we actually understood what was going on 20, 30 years ago. Sickle cell anemia can be treated and the person completely, if you will, cured in that situation. Multiple myeloma, Fanconi's anemia, immune disorders, severe SCIDs, you're probably familiar, the boy in the plastic bubble. They're treating patients with stem cells, their own stem cells. MS, lupus, Crohn's disease, which is an autoimmune disease. Next, please. Parkinson's disease, again, one that you hear out there, and unfortunately, I wish I could talk to some of the celebrities who are saying we need embryonic stem cells because there are trials underway treating patients. After bone marrow is irradiated, lethally irradiated, that's how they rescue bone marrow, is with the stem cells. And even for corneal reconstruction, and there are others. I tried to kind of limit it here. For adult stem cells, I think the versus embryonic stem cells, the message here is a clear one, and it's a message that you don't hear in the press. You don't hear it on 60 Minutes or 2020. There are over 1,100 FDA approved, that's just in the US now, FDA approved clinical studies using adult stem cells. The number of clinical studies in this country with embryonic stem cells is 0. So this tells you that we are leaps and bounds ahead, not just in research, but in the clinic, in the use of stem cells. And what seems to be working quite well and has fewer hurdles are the adult stem cells. So let's now skip to medical and ethical issues, because this is wonderful, and one would say, okay, well, that's great, but maybe we have something we can do with the embryonic stem cells. Well, we have to look at everything now that we know the scientific facts and what's going on in medicine. What are the medical and ethical issues? Well, let's first talk about the embryo. A lot of this started back in the days of Aristotle, deliberating, what is an embryo in human life. And the general agreement, and this is with scientists, whether they're for or against embryonic stem cell research, it is alive and it is human. It has a full complement of DNA. It is human. No one can say it is not human. No one disagrees that it's not human. The textbooks in embryology will tell you it's a human being, unless they've changed the most recent one coming out. It has all the DNA it needs to be regarded as a human being. It possesses this, what we call an internal code for self-actualization. It can become, on its own, a fully potential, competent adult human being. It's an organism. It's an organism already. It's not on its way to be an organism. It is an organism. It is a full being, independent. Now, obviously, it needs nurturing. But, you know, to say it's fully independent and on its way to become an adult but needs nurturing is the same thing you would say about a newborn or a baby, correct? So all we're talking about here is where we are on the development path. Here, 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 here. And so what is the problem that some people have and why they want to say it's okay to use embryos is they're debating whether it's a human person. Well, person, when you talk about person, you're talking about now giving characteristics to it. Consciousness, being able to make decisions, being able to see, to talk, you know. You see where I'm going with this, because as soon as you start putting qualifications on what is a person, which is something that science can't do, where do you stop? It's discriminating. Where do you stop and say, okay, this is a human person, but this isn't? Next, please. So, again, the attributes of science and moral theology, think about it. Science measures. We measure, we weigh things, we find out how long or how much, what the molecular weight of a molecule is. Moral theology doesn't do that. We don't say, you know, how many pounds of love we have for this person. It's two different fields, and that's why I always say science and morality or science and religion do not conflict. They look at two totally different areas in different ways. In fact, they actually are in agreement if we really take what each has to say. What the problem we run into is when we have science dictating and mandating and making decisions that science cannot make. Science cannot determine the attribute of a human person. Next, please. So, well, back to the question I posed earlier. Why not pursue both approaches? I mean, from a scientific standpoint, and that is what I've heard scientists say, I've heard legislators say, well, okay, so we're so much further ahead. Why not pursue it? Let's pursue both and see what comes out of it. Well, there's a lot of good reasons, but just on the ethical side, well, on the scientific side, the hurdles are there. But on the ethical side, it's regardless of the eventual scientific advances that may or may not be overcome. But anything is possible with enough study and enough money and time to fly in the face of a highly charged issue such as embryonic stem cell research, you know, where there is ethical concerns. I mean, and there's people that are all different areas along this whole issue. To fly in the face of that, where there is an advanced alternative, is just totally unacceptable. If the ethics weren't involved, I'd say, fine, go for it, even though I don't think it's a good business decision, and I'll talk about that. But when you've got such highly ethically charged concerns, why would you take a more difficult course? Why not take a course that is there and is working? It smacks in the sense of research for research's sake, or what I call academic freedom. And I say this too. I testified here in the state of Florida Senate at some of the committees, and also I was asked to testify at in the state of Wisconsin. And at both of the hearings at the various Senate meetings, those two states, it wasn't business that was there to support embryonic stem cell. It was the university. It was academicians. And this is a very important message I want to leave with you. And I'm an academician. I mean, I teach. I come, from that whole field. I'm a bench scientist originally, and I'm not trying to degrade. I'm just trying to put things in perspective for you, for all of us. Next, please. This was a quote from Varmus, one of the Nobel laureates. And by the way, you see this long list of Nobel laureates who support embryonic stem cell research. I challenge you to go on the internet and find out what their background is and how many of them have ever done any work in cell culture. They may be mathematicians or geologists or, So just being a scientist doesn't make you in a position to even judge scientifically embryonic stem cell research. And as I said, science is not in a position to morally judge it either. This was a comment that he made, which, and again, I understand this being a scientist, but he says, ordinary people care about the destinations of science, the answers, the miracles, the cures. Now, don't be offended by the next one, it says, but the scientists care most deeply about the journey itself. There are a lot of juices flowing when you work in the lab, so many things are at stake: careers, competition, people's ideas of how the world works. And then succeeding at the bench gives you that incredible rush. And I've been there. I know what that is like, that incredible rush, that high that is up there in a scale of human pleasures.